Imagine a headache so relentless, so blindingly painful, that the doctor's only prescription is to take a drill, bore a hole through your skull, and carve an opening to let the demons out. Imagine a child burning with fever, and the prescribed cure is to drain their blood, measure by measure, until they are pale, limp, and weak. This wasn't the script from a horror movie. This was the accepted, standard, and often the only medicine available for over 1,000 years. Their understanding of the human body was not a science, but a dangerous and tragic guessing game. This is the story of how, in an age before science, medieval doctors got almost everything wrong. To understand why medieval medicine was so fundamentally and catastrophically flawed, you have to start with its absolute foundation, the theory of the four humors. Its roots trace back to the ancient world, to pre-Socratic philosophers like Empedocles. It was the Roman physician Galen who truly perfected, systematized, and elevated humoral theory into an unchallengeable doctrine. Each humor was linked to one of Empedocles' four elements, one of the four seasons. Medical training was almost entirely theoretical. Students didn't examine patients. They read Galen like scripture. Galen himself had mostly dissected animals, leading him to make over 200 anatomical errors. This theory even defined your personality: sanguine, phlegmatic, choleric, melancholic. If you had a fever, the diagnosis was obvious: an excess of blood. The solution? Remove the excess blood. Galen's belief in a divine designer fit perfectly with Christian doctrine: elegant, comprehensive, and completely fictional. The foundation was flawed, so everything built upon it was doomed. Perhaps the most infamous and widely used medieval cure was bloodletting. The idea was simple, if horrifying. Sickness was caused by an imbalance in the humors, especially blood. And so, the doctor would slice open a vein or apply leeches to drain the illness from you. It was dangerous, unsanitary, and often lethal, but it persisted for over 1,000 years. Barbers often doubled as surgeons and would perform this gruesome task without anesthesia or hygiene. Entire hospitals had bleeding rooms where patients would line up for their daily draining. If one bleeding didn't work, the doctor might try again, or add a purge or an enema. Some physicians even measured the stars before choosing a vein to open. More often than not, bloodletting made things worse. But patients and doctors alike believed the theory was sound. The real horror is that this was not fringe medicine. This was the standard of care. If bleeding wasn't enough, perhaps you needed a hole drilled in your skull. Trepanation, one of the oldest surgical practices in human history, was alive and well in the Middle Ages. It was used to treat seizures, mental illness, and migraines by physically opening the head to release pressure or spirits. In monasteries and battlefields alike, rudimentary drills or chisels were used to penetrate the skull. No anesthesia, no sterilization, just a firm hand, some prayers, and unimaginable pain. Many patients died from infection or trauma, but a surprising number survived. Some skulls from this period show signs of healing, proof that the patient lived, at least for a time. Why did doctors do it? Because they believed disease came from outside forces, evil spirits, bad air, divine punishment. If your body was a battlefield, then surgery was a kind of exorcism. Surgery in the Middle Ages was not for the faint of heart, literally or figuratively. Surgeons were more like butchers than healers, working fast and rough with crude instruments. There were no antiseptics, no understanding of germs. Wounds were packed with moss or cauterized with red-hot irons. Amputations were done with hacksaws and hammers, with patients held down by assistants. Survival often depended more on luck and infection resistance than skill. Yet even within this brutal world, there were innovations, tools, manuals, and battlefield practices slowly improving outcomes. Islamic scholars preserved Greek texts and developed surgical techniques far beyond those in Christian Europe. But most European medicine was trapped in religious doctrine and Galenic dogma. Surgeons were seen as low-class laborers, while true physicians wouldn't dare touch a body. When diagnosis was needed, doctors didn't run tests. They read the stars. Astrology was considered a legitimate science and heavily influenced medical advice. Doctors would consult star charts to determine when to operate, when to bleed, even when to administer herbs. Another key diagnostic tool, urine. Medieval physicians examined the color, smell, and taste of urine to divine internal imbalances. They carried urine charts, showing various hues and their meanings, like a witch's spellbook. Uroscopy was often more performance than science, a spectacle to impress wealthy patients. Even the shape of your stool could be discussed in formal Latin texts. In this era, bodily fluids were a language, and doctors were terrible translators. Where medicine fails, charlatans thrive. The Middle Ages were full of snake oil salesmen, miracle workers, and traveling potion hawkers. Some offered genuine herbs with mild benefits, but most sold lies in fancy bottles. Fake doctors would copy Latin texts, don impressive robes, and set up shop in desperate villages. They preyed on fear, faith, and ignorance, charging the sick for spells, relics, and cure-alls. Royal courts weren't immune either. Many kings and queens employed astrologers and alchemists as physicians. And the church? Sometimes it blessed the quacks, especially when their cures aligned with doctrine. The line between faith healing and fraud was blurry, and often fatal. Women's health in the Middle Ages was governed by superstition and misogyny. The most infamous belief? That a woman's womb could wander inside her body, causing illness and madness. Doctors prescribed scents to lure the womb back into place. Sweet at the vagina, foul at the nose. Women were seen as colder, wetter, and weaker, physically and mentally. Midwives, despite their expertise, were often marginalized or persecuted as witches. Childbirth was brutal and deadly, with little medical support. Many women died in agony and silence. Gynecology as a science barely existed. Instead, women were blamed for hysteria, sin, and seduction. For over 1,000 years, medicine in Europe was trapped in a fog of myth, magic, and mistakes. It would take the Renaissance, the printing press, and the rise of anatomy to finally begin breaking Galen's grip. Real progress didn't come until science challenged tradition, and doctors dared to cut open the truth. Medieval medicine was not just wrong, it was deadly. And yet, it reminds us how far we've come, and how terrifying it is when ignorance wears the mask of authority. So next time you get a headache, be grateful you live in the age of Tylenol, not trepanation.